Rheumatoid arthritis is a chronic inflammatory synovial lining hyperplasia causing angiogenesis and infiltration of the mononuclear cells, causes pannus formation, causes cartilages erosion and joint destruction. It occurs in 1% of adult only, mainly females, age 40 to 70 years percentages. Etiology: HLA-DR4 is the most risk entry factor. In India, HLA-DW, concordance twins, in infection, mycoplasma, mycobacteria, E. coli, Epstein-Barr virus, EMV, parvo, rubella, and in smoking, HLA-DRB1. Pathogenesis: increased cellularity and synovial infiltration causes B cell macrophages and fibroblast activation. B cell produces plasma cells and also rheumatoid factor, and it causes activation of the complement. Activation causes fibroblast proliferation, vascular infiltration, and granulation tissue formation, that is pannus formation, causes increased enzymes. Collagenase causes bony and cartilaginous destructions. Both joints are symmetrically involved in decreasing order. Metacarpophalangeal joint, wrist joint, proximal intermittent joint, knee joint, metatarsophalangeal, shoulder joint, ankle joint, cervical spine, hip, elbow, temporomandibular joint. It's paired in distal phalangeal joint and sacroiliac joint. So backache is not a feature because it is paired sacroiliac joint. Rheumatoid nodules in 25% of in the olecranon process, and methotrexate causes increased nodulosis. Kaplan syndrome, rheumatoid arthritis with cold workers pneumoconiosis. Welty syndrome, rheumatoid arthritis plus splenomegaly and neutropenia. Symptoms improved with pregnancy. Deformities: swan neck, Botnese deformity, also known as bottom neck deformity. Sudden onset flat foot, tibialis posterior insufficiency. Baker's cyst, telescoping fingers, main N, Lorzenda deformity. Protrusia accetabulae, hitch strikers, Z deformity. Wind swept deformity, torch-like. Diagnostic criteria is 1987 American College of Rheumatology, that is early morning stickiness more than 1 hour. Three or more area is involved. Hand joints are involved. Symmetrically involved. Rheumatoid nodule and rheumatoid factor is positive for 6 weeks. And also 7 the subcutaneous nodules and radiological features. Radiological features are symmetrically narrowing of the joint space, early articular erosion and marginal and central, periarticular osteoporosis, soft tissue neck swelling is earliest sign. And also investigation anti-CCP is the earliest stages prognostic criteria. Rheumatoid RA factor, that is only 60%. Rheumatoid RA factor is positive in sometimes false cases like cryoglobulinemia, parvovirus 19, hepatitis C virus, SLE, Sjogren's syndrome, 5% in normal individual. Malaria also RA factor is positive factor will be good. Then next is a treatment. Treatment is in a acute stage treatment with a corticosteroid for 1 to 2 weeks and disease modifying anti-rheumatoid drugs, hydroxychloroquine, BD for 2 weeks. It causes bull's-like macropathy. Sulfasalazine, methotrexate 7.5 milligram once early morning, weekly morning only. Even leflunomide and methotrexate causes bone marrow suppressions and biological DMRDs, monoclonal antibody, idanercept, infliximab, anakinra, adalimumab, golisumab, tocilizumab. Thank you. This is rheumatoid arthritis.